We'll take breaks every so often. We got a lot to cover. So again, on your side, whatever you can do to have the best experience on the webinar platform, but we've got hundreds and hundreds of you on multiple platforms. So it's really great to have you here, and so great to have you. Just to give you an idea, and please keep putting in who you are, where you're from, what kind of healthcare professional you are. We have got so many of you. We have got MDs, Chica, I don't know if that's the way to say it, from Randolph, New Jersey, Sarah from New Hampshire. We have got Cheryl, who's an NP from Georgia. Great to have you here. We've got Georgia, who is a dentist in Florida. Funny how that works. We've got Ahmad, who's a trauma nurse, ICU. So Maria, who's a dentist. You get the idea. We've got, there's no way I could call you all out. So I apologize for all of them. But, Kelly, who's an RN, Marcy, who's a PA, Rachel, who's an RN. It's great to have you here. Hi, Michael, all the way from Hawaii, who's an MD. Amanda's an MD. So you get the idea. We've got everybody here, and so great to have you here for all of that. We are really blessed, and thank you. And we're going to make this year a great, great year. So we're going to get going because we do have a lot to go ahead and do. So let me just do the brief introductions here. And again, feel free to ask questions at any time. But my name is Dr. Louis Maltzmacher, and I'm president of the American Academy of Facial Aesthetics. There's my email if you want to reach out to me. If we don't get to your question or you have questions, and then the AAFE's email, info@facialaesthetics.org. All the different websites, we'll touch on some of them. AAFEtraining.com will answer all of your training questions, cadaver labs, webinars, which is how many of you found this, the Tox Test Drive. If you are a dentist, this is a program specifically for dentists right now. If you are a dentist, go to Tox Test Drive, and it is a whole new program by the AAFE and one of its partners. Well, the partner is StatDDS, in offering your patients 10 free units of toxin to stimulate them to go into your practice. You can go there, and right now it's for dentists only. That's just the way it's set up, but it will expand over time. But if you're a dentist, you can go register right now. There are actually 2 spots left. They only open 20 at a time for that, and it can be you can watch and take a look at that for that. StatDDS.com, Soft Lift Wave Aesthetics. We're going to talk a little bit about not all of them, but most of them as well. But please go ahead and follow the AAFE on Instagram, Facebook, YouTube, and TikTok, where we have got hundreds of thousands of followers across all the different platforms, and we are thankful to all of you for being part of our community as well. And like I said, AAFEtraining.com for level 1 Botox and fillers. If you're getting started, that's the foundational, and it is the most comprehensive foundational that's out there. Level 2 advanced, level 3 master classes in Botox and fillers, smooth lifting PDO threads, level 1 oral facial pain, trigger point therapy, cadaver lab, and ultrasound. The best one out there by far, very intimate, so you get a lot of attention. It's not one of these used ones where you see 50 people and everyone can barely touch anything. For that, master nose, lips, and eyes, and lots more. So you can go to AAFEtraining.com, and here is the upcoming in the next few months. They've got all of 2023, even part of 2024 already I think, scheduled, but definitely all of 2023. Grab a package, which is just a number of courses. You will save a lot because tuition is going up January 19th, like everything else in the world. Have you seen the cost of eggs? It's crazy what's going on out there. Literally, it is absolutely insane, but everything is going up. So there are only 10 of these packages available. And again, the higher the package, the more benefits you get. Certainly AAFE membership for bonuses, additional discounts, and you save a lot more with more courses. Plus the fact you can take this year, next year, you can take this anytime you want, and you can lock in the price for all of that. And these are the upcoming, and you can see level 1, 2, 3, they're all designated for the different areas for that. So we hope to go ahead and see you at one of these upcoming sessions for sure, but all your questions go to AAFEtraining.com. Oh, I forgot. Use that code AAFE500. You'll save an additional $500 off gold and higher packages for all that. And please, for crying out loud, make sure that you go ahead and take CME, real CME, live patient certification training. Every single medical, dental, nursing board knows the AAFE very well. We've got many AAFE members who are actually board members on some of those boards there as well. So this is not, I just met with a nurse practitioner who told me, yeah, she had a little bit of this training, this manufacturer came out, that manufacturer came out, and she, was treating patients, but really did not have a lot of ideas of a real curriculum and path, and also how to take care of complications. That was actually a scary conversation. But we'll leave that for another time for all that. But let's jump in to a couple things. There's our cadaver course. You can go to AAFEcadaverlab.com. That's $1,000 off for a very limited time. It's only $32.97. You won't find any other cadaver lab that will even come close. Next one's in Las Vegas, February 25th. And for Lauderdale, Scottsdale, you see what's going on during the year, so you can see all of that. And then in 2 weeks, same time right here, this is going to be a online training on Learn Perfect Tear Trough Treatments with Botox fillers and PDO threads, Tuesday, January 31st, only $79 through January 26th. It's normally $249. This is going to be a very intensive online training on the #1 requested treatment by patients. These are some of the worst tear troughs we've ever seen. She had been to multiple providers before. We fixed them in one appointment, and we will share with you her case and many other cases there as well. So if you want it, grab it. There are only 200 spots total, and you can save a little bit more before January 26th, which is next Thursday, but it includes a 14-day replay. So you can replay this in case you can't make it. You're going to want this because this is the year of the tear troughs. It's already been the year of the tear troughs for sure. Go to AAFEwebinars.com right now to make sure you secure a spot. And with that, let us get going. What do we love about Botox and fillers and PDO threads? But Botox certainly is the most popular injectable that's out there. We love that it's a recurring revenue center. It only lasts 3 to 4 months. New one on the market that may last up to 6 months. We'll have to see. It's the happiest part of your practice. None of this insurance nonsense. So again, whether you're a dentist, physician, nurse practitioner, or PA, the amazing thing is it is an equalizer because you can be the best injector and you can have, doesn't matter the letters that come after your name as long as you are a licensed medical professional. That's the incredible thing. And you can finally get paid what you're worth. Whether you're a dentist, physician, nurse practitioner, or PA, you can really get paid. You put the work in, you get great training, you get some experience, and the AAFE is the only training institution, by the way, with post-course support, real post-course support. We have 5 full-time faculty that are just there to help you get started and treat patients for all of that. And it's non-surgical, there's no capital investment. This is the only thing you're investing in is your hands and your skill, which you will have for the rest of your career. AAFE members in 2022 were up 35 to 48%. I would venture that most of you who have practices, probably your practices were flat or maybe a little bit down. You certainly were not up 35 to 48%. That's a big deal. And if you're new to this and you've been thinking about it, now is the time. If you would have started a year ago or 3 years ago, imagine what kind of practice you would have. It's really a dream practice with injectables. But now let's dive into this because masks have really changed facial aesthetics. And there's still plenty of people wearing masks, but even wearing them for a year or two. And we still have to wear them, certainly where I am when you go to medical appointments. Many places where you want. Some of you just like to wear masks, and that's great. Whatever works for you. But what happened? The upper face became more active because those muscles were emoting more because you couldn't see the lower face. A lot more stress and clenching and everything else that's going on. The facial muscles, and this is a young patient that you see, by the way, here. The facial muscles were going crazy. Masseters bigger than we've ever seen them. Increased muscle action that increases collagen loss, which gives you these nasolabial folds. Not our topic tonight necessarily, except when we get a little bit to PDO threads for that. And it's accelerated facial aging by about 5 times the volume loss. That's amazing here. That's the world we live in. This is why people want more injectables now than ever before. And the amazing thing about Botox is it's always in the news. I could just open up in the last week, I could give you all kinds of headlines about that. And don't think that aren't lots of people, famous people that you know. There's a reason she looks as good 50 years later than than she does in 1970, right? I mean, this is not anything that's ashamed anymore by anybody, and it's almost to be expected. People don't want to age, and that's okay with me. Hopefully that's okay with you as well. But certainly that makes this pretty much inflation and recession proof, because we've still seen this climb of injectables even with all the craziness that's been going on. We saw it in 2008, by the way, and we couldn't believe it. But I mean, there are a lot of reasons for it, which we'll leave for another time for all of that. But let's talk about these neurotoxins, and we'll call them all just in one bucket. We'll call them Botox for this. I'm going to turn off, those of you on the webinar platform, I'm just going to turn off the webcam for now because we're going to get into videos right away. I'll see you all later here. But we're going to call them all Botox, even though they're not all Botox, but Botox certainly is the most well-known of that for that. Number 2 is Xeomin, which is great by the Merz company. It's got the same unit structure. So, and Botox, if you don't know, botulinum toxins are dosed in units. And so 100 units of Botox equals 100 units of Xeomin. And Xeomin is a little less expensive. It's a little cleaner molecule, if that means something to you there as well. They'll all work the same. They'll all work really well in your hands. Dysport, little bit of a difference in unit structure. You need more units. It doesn't mean it's weaker. It just means that it's just a different unit structure because it's a different molecule. Jeuveau is a relative newcomer. We'll still call it the rookie on the block, even though it's been around for a few years. A little bit more technique sensitive for all of that. But Botox Xeomin is what we use in the AAFE quite a bit. We use them all, but Botox and Xeomin, we use them all. But to be a great injector, it's about anatomy, safety, and technique. That's what it's really, really about for all of that. How does it work? Just to refresh some of your memories or tell those of you who are brand new to this, fairly simple. You inject botulinum toxin, again, we'll call that Botox, into the muscle. That's where you go ahead and inject it, not into the skin. It goes into a muscle, and that botulinum toxin molecule goes to the neuromuscular junction. It attaches, it starts to release, it stops the release of acetylcholine, which is what the neurons use to activate motor muscles. And why do you have wrinkles in your forehead? It's because you've got a great muscle there called the frontalis muscle, and that muscle raises your eyebrows. You can all do that right now. Raise your eyebrows. Many of you have had Botox, so you can't raise your eyebrows. But those of you who haven't, raise your eyebrows. And when you go back to rest, over time, it leaves wrinkles. And that is why you have wrinkles. Not from the skin, it is from the motor muscle underneath it. If you go ahead and inject botulinum toxin into the muscle, listen carefully to the timeline. It takes 2 to 4 hours to go ahead and attach to the neuromuscular junction. You do not want to upset it at that time. And then you go ahead and then slowly over time, and within a day to 10 days for full effect, depending on the molecule, depending on the patient. Many times it really just depends on the patient. It starts to take effect, and the muscle goes to sleep. Skin's natural state is smooth, and that is exactly how botulinum toxin works to smooth skin. It's also great for oral facial pain. And yes, I didn't include a newer neurotoxin that is called Daxxify, that is supposed to last up to 6 months. It's interesting. It's people are just getting used to it and using it. So we will see. It's not even on the market, on the broad-based market for 6 months. So we'll add it later on. Is it for those who are just getting started in delivering botulinum toxin? Probably not, because if you have a complication, that complication is going to last for 6 months, and that could be a dropped eyelid and dropped eyebrow. So you've got to have pristine technique to use a long-term neurotoxin. And great for oral facial pain, by the way, it's fantastic. We'll see how it goes. So we'll have more to report as that goes on a little bit later on, but certainly not for newbies. I would not recommend it for newbies. Yeah, but they all pretty much work the same. But except for Daxxify, which is the 6-month neurotoxin, the other ones will last about 3 to 4 months. Interesting, there are some studies that are coming out now more recently, probably because this new neurotoxin came out. Studies coming out showing if you increase the dosage of Botox and Xeomin and Dysport, and guess what? It will last longer than 3 to 4 months. So we'll see how the whole thing shakes out for all of that. It's a good thing that it is a temporary procedure for all of that, and patients come back. I mean, most certainly do come back for all of it there as well. So that's pretty much how it works in the mechanism of action. And that's what's new. But what you really got to know is the anatomy. It is all about the anatomy and knowing the muscles and knowing how the muscles work. Some pull up, some pull down. You can balance the two to really get, you can literally can reshape the face. People that go through the AAFE level 1, level 2, level 3 are in curriculum of botulinum toxin and dermal fillers can literally reshape a face by treating a lot of different muscles, but not just treating them, it's how you treat them. It's which parts of the muscle you still leave active. You can literally make a beautiful face just with botulinum toxin. For that, complications, the biggest one is going to be, of course, lots of injections will give you some swelling, a little bit of bruising. For sure, there's really minimal swelling if you do everything right. You really clean the patient, use very sharp needles, you know the anatomy, and especially knowing where some of the vessels are so you can stay away from some of that bruising. But other complications are a dropped eyelid and dropped eyebrow because your botulinum toxin got to the wrong muscles. And that's not very pleasant for anybody, which is why technique, which we're going to show you, is so darn important. But so is comfort. Comfort is so important. That's why the only needle we use for botulinum toxin delivery, no matter the botulinum toxin, is going to be something called ComfortTox. You can get it at statdds.com. It is by far the most comfortable because it is the sharpest. Look at those micrographs, and you can see a ComfortTox needle right out of the wrapper, and that is nice and sharp. It's got a multi-bevel tip, which means it goes in easier, it's more comfortable to patients versus another very popular brand right out of the package, and you can see how rough it is. What do you think is going to be more comfortable for you or for your patient? By far, the ComfortTox. It's the only thing we use in AAFE training for all of that. So that's it. So let me go ahead and show you our first patient. So we're going to get going with a video here, and let me show you our first patient. By the way, she's been getting botulinum toxin for 5 years already, and she's only in her 20s. And you need to know, it's something that we've talked about before, that up to 35% now of injectable patients coming in are Gen Z and millennials. That is incredible because they're the first generation and demographic to consider botulinum toxin, dermal fillers, PDO threads as self-care like hair and nails. No shame in doing it, and they come in early for prevention, as you're going to see. So let's go ahead and show you her case. Here we go.
Okay, so now we have Stephanie in the chair again, and we are going to do her full face of neurotoxins. You can see she's got little dots all marked up, ready to go. So I'm just going to kind of go ahead and get started, and as I go through the areas I'm treating, I'll kind of talk about it. So we're starting with her frontalis. So I'm only giving her a total of 4 units of neurotoxin, only because her forehead is kind of short. She's not very strong, and she does have a little bit of hooding, so I don't want to drop her too much. So I'm basically only giving her 4 units. I just kind of added saline to my syringe, just so that I'm pushing an even amount in each injection spot. You can see I'm going right next to the dot, kind of going directly right into that muscle. It's almost like a release of tension, like I'm just popping into that muscle, and then once I'm in the muscle, the neurotoxin pushes in really nicely. If you're ever, turn towards me just a smidge, perfect. If you're ever injecting, you feel like you're having a hard time pushing the plunger, you're probably just a little too superficial. Still in like that epidermis, so just get a little deeper into the muscle and it should go right in. Okay, so that's done. Now we're gonna move down to her glabella. So if you remember from her assessment video, she was pretty strong in this area, so I'm giving her a total of 20. So 4 units in each injection spot. So first the Proceris going straight in and giving 4 units, and then isolating the corrugators and giving 4 units medially and laterally. Again, just going right next to my dot. You never want to inject right through a marker just because you don't want to tattoo a patient, but also just for sterility reasons, just to be clean. So I usually just kind of mark a little off of where I actually want to inject. That area is done. Okay, then kind of coming down to her crow's feet. She doesn't really have much of crow's feet to even speak on. Big smile as big as you can. So she's very minimal in this area. So I'm only giving her 2 units, like 4 on either side. You can relax, turn your head a little bit. And this is mostly just for preventative reasons. Because she gets injected everywhere else, you can't really ignore certain areas, because then they're gonna start to appear differently from the rest of her face. Turn towards me a smidge. So same thing over here, 2 and 2. Always injecting up and away from the eye. Perfect. Okay, then we're gonna come down to her nasalis muscle, so look straight on, scrunch up your nose for me. So we're treating this muscle here. So this horizontal line, treating the Proceris will help relax that. And then these little itty bitty lines that kind of come into a V, those are her bunny lines, that's what we're treating. And I'm mostly just doing this on her because I know we're gonna end up doing nose filler, and I wanna make sure that this nose filler that I place here isn't gonna move. So we're just doing it very lightly. I'm only doing 2 and 2 on either side, kind of following the bridge of the nose. It's a pretty superficial injection and just giving 2 units per side. Also keep in mind for this injection, this is not an area I treat if a patient has to wear glasses or if it's sunny out. Make sure your patients aren't leaving and putting sunglasses on so that it doesn't, migrate down. Okay, next moving down to her mentalis. So do like your sad face. Yeah. So kind of creating that little bit of dimple puckering in the chin, relax. Also responsible for this mental crease. So again, I'm just treating her very lightly. I'm gonna do 4 units total. So 2 and 2 medially right into the center of that muscle. And I'm mostly doing this, again, because I plan on placing dermal filler in her chin. So I wanna make sure that muscle is good and relaxed. Next, we're moving down to masseters. So she is a clencher grinder. So we are going to be treating her masseters. She's not super strong, so I'm only gonna start her at 10 units. If she had a super prominent, strong muscle, 10 units probably wouldn't touch her, but it's really not too bad. So I'm gonna start her at 10 and see where that gets her. Probably check her back in 2 weeks and see if I need to add more. But we are treating her superficial and her deep. So you can see I have 2 dots here. She does complain of some ear trouble, and usually that is an indicator that something's going on with her deep masseter. So I'm gonna treat both. And close to the mandible so that I'm avoiding that risorius muscle. And then the deep is pretty close, far back, right underneath that zygoma. Go ahead and bite down again. Good, relax. And I'm just gonna go straight in. And I'm only giving her 5 there. And then we're gonna do the same exact thing on the other side. So again, bite down, perfect, relax, straight in. That was 10, and then we're gonna give 5 in straight in, so right under, and I'm only giving her 5 there. And then we're gonna do the same exact thing on the other side. So again, bite down, perfect, relax, straight in. That was 10, and then we're gonna give 5 in this deep as well. So right under her zygoma, go ahead and bite down. Good, relax, and it's just gonna be straight back. I usually angle a little further back towards the ear because I don't want to hit her zygomatic major. And that is it. She got I don't know what her total is because I didn't write it down. But she got quite a bit of neurotoxin, so we'll give that 2 weeks to kind of settle in, and then I will see her back for a 2-week follow-up and see if I need to do any enhancements.
Alrighty, so now here you can see her before and after. And by the way, I mean, a few things on her. If you go ahead and inject a patient the way she injected that patient, you are making a huge mistake. Not because she did anything wrong. She did everything right for that patient. It's the right dosaging. It's the right markings because it's the right evaluation and consultation with the patient, knowing what the patient wants. But this is very specific treatment. There are so many people, some of you are probably maybe want to ask or were thinking of asking, well, how many units is it? Why, okay, now I know exactly where to inject other patients. No, you don't know anything about where to inject other patients. Why? Because this is very individualized treatment, right? That is why. That is what it is. It's like I wear glasses, so it's like somebody, imagine someone asking my optometrist or ophthalmologist when I walk out of the office, or another ophthalmologist asking my ophthalmologist, "Hey, what did you prescribe for that guy?" I'm going to do the same thing. No, that's ridiculous. All this is very specific. Everyone's muscles move differently, certainly different ages along the ways. And certainly, she obviously got some lips there as well and a few other things. So it's really important that, everyone's looking for that magic. Oh, that's the spot I inject. Yeah, that's the spot on her. If you inject that on your patients, you're making a massive mistake. But let's show you something really cool. And this is what I mean by all of these different muscles are related. And feel free to ask questions because we can take some questions a little bit later on, or we'll take a break at some point to ask questions. Let's show you something really cool. Let's go ahead and let's talk about something called peanut head. Peanut head is that temple area. Some people just have really a loss of volume in that temple area. What if I go ahead and inject the masseter muscles? What will happen to that? Well, if you inject one muscle, there's two sets of muscles that work together all the time. Your temporalis muscle on the side of your head. If you bite all of you can do this now. Feel the side of your head where your temple area is. Bite your teeth together. You'll feel that temporalis muscle go ahead and pop out. If you do the same thing at the same time, go ahead and bite down. Feel your masseter muscles all pop out. All four of them work together. What if I just treat the masseter muscles? This is not for someone that has got oral facial pain, because you will need to treat all four of those muscles, 2 temporalis and 2 masseter muscles. But what if I have someone who has lost volume in their temple area, and I can increase the volume by just injecting their masseter muscles, relaxing the masseter muscles? That causes the temporalis muscles to bite harder, and that temporalis muscle, like any muscle, the more you work it out, the bigger it gets, and that can fill in a little bit of volume. Pretty cool. And here's certainly a study that talks about that as well. But let's show you a patient. That's what we want to do. So here we go. And this is on a young man here. So here we go. We have got Abe here in the chair, and we are going to treat him with some botulinum toxin. But one thing in particular that we really want to point out the masseter muscles. His masseter muscles are fairly big on him, and we are going to go ahead and treat those along with regular botulinum toxin there too. But now go ahead and just go straight on to him, and you can see his peanut head there a little bit, which is unusual for a young man, but naturally he is deficient in the temporal region there. Now, what would you normally do for a patient like this? You could go ahead and add filler, but for him, the best treatment to fill up that peanut head, that natural volume deficiency right there, is to go ahead and treat the masseter muscles and don't treat the temporalis muscles. Because if you treat the masseter muscles, then because they're all muscles of mastication, and the masseter and temporalis muscles are the only ones that work together on both sides, if you treat the masseter muscle and take down the intensity of contraction for those masseter muscles, then the temporalis muscles actually have to work a little bit harder, and all of a sudden you will see this natural peanut head get filled in a little bit, just because that temporal muscle, that temporalis muscle will be bigger because it's got to work a little bit harder. Now this only works on patients that do not have a history of TMJ, oral facial pain, and that kind of thing. If it does, then you got to treat the temporalis and then fill that temporal deficiency a different way. But for him, he's the perfect case, and you may have seen him in the AAFE. We've taught for many years how this can be a possibility, because if you know the muscles and you know botulinum toxin, this can work really well for him. So let's go ahead and start treating him just with our normal treatment. We'll start with the frontalis muscle, and we'll take you all the way down, but now you have a good idea as to what we're doing here. So frontalis muscle treatment, that is going to be the same, and we are going to prevent and remove any wrinkles here. We're using ComfortTox syringes, the best syringes on the market for botulinum toxin treatment here. As you can see, we've marked out the treatment areas we want to get to, nice and spaced to cover the entire frontalis on him. He's starting to develop some wrinkles in his forehead, doesn't like it, and again, if he does have any kind of headaches in this area, that certainly can take care of it, but this is primarily for treatment for the aesthetics here. And you can see how nice and easy that goes in. That's what the ComfortTox syringes are the best. That's why we use them exclusively in AAFE training, is because patients really love them and clinicians really love them there as well here. So that is the frontalis muscle. Doesn't take very long to deliver. Now, because he's a man, we are going a little bit heavier on the dosaging because the muscles typically are a little bit bigger here. Now, the glabellar area, and you can see the procerus, just going to go right in to that muscle here, and we are going to deliver that, and we are going into the corrugator muscle. Take a look at the corrugator muscle. Look how we are holding that corrugator muscle to really isolate it, because if we go ahead and squeeze it another way, then this can get down, the botulinum toxin can get down to some of his eyelid opening muscles, and we don't want that. So really isolate that. This is all technique, and that's the beautiful thing about botulinum toxin. It's relatively easy to get a great result if your technique is really perfect there. So if you've been trained by the AAFE, you know that this is the kind of technique that we look at for delivering this botulinum toxin here. So now let's go. We will go ahead to the crow's feet. That's what we're going to do on both sides. And again, he's starting to get some wrinkling there as well here. So you can see we usually like to hold it really tight, and this way we can go ahead and spread that tissue around and then just slip right underneath the tissue. Again, because he's a man, the dosages are up just a little bit compared to if he were a woman. He's definitely got stronger muscles here too. So, and in this area here, you don't want to give too much ever in any area, because if it gets to the wrong muscles, things can happen, but you're not going to really overdose this area very much here. But so you want to give a reasonable dose to make sure that you get a really good response here. Now, as we wipe the patient up, you're always going up and away from the eyes, and that is really critical. You want to make sure that you are always up and away from the eyes. You don't want to force that botulinum toxin down into any muscle that should not be getting it right now. So that's important here. And then we will get to the masseter muscle to go ahead and deliver that treatment. Now we're going to give him a good dosage on the masseter muscle here, because this is what we are trying to accomplish. We want to reduce the intensity of contraction of the masseter muscle, and that will cause in him the temporalis muscle to get a little bit bigger and work a little harder, which will give us volume in his case, which is exactly what we want. A lot safer, obviously, but I shouldn't say a lot safer, but you know when you do dermal fillers, there are risks involved for sure. And certainly we teach the fillers in the temporal area all the time with different techniques. And then one more masseter injection, as you will see, and that will be the end of this treatment. But you can appreciate those are fairly big masseters, so this is going to be a pretty healthy dosage on him. In, give it, and out. It is that simple if you know the anatomy. So that was the entire treatment for Abe here. Abe, how did you do?
Excellent.
Yeah.
Comfortable as usual.
Right. And when was the last time you had botulinum toxin?
I don't know offhand.
But it's been a while. Does it help?
Yeah.
Does it help you?
Definitely does.
Yeah. So you really like getting it. So that's it, folks. And thanks for being our patient, Abe. Here you can see a fantastic before and after accomplishing those goals. Look at those slim down masseters. Patient loves it. Feels much better, but look at the temple region. Everything else looks great too, but look at the temple regions on both sides and you will see more temple volume because of that temporalis muscle. You've got to learn to do this for your patients, and you've got to get AAFE certification trained today. All right, and you can go ahead and see. You can see on some of these, just the light reflection is different, but you can certainly see this curvature right here. It's just amazing what you can do. Again, this is subtle. This is not a ton of volume, but it's exactly what he needed for that, and it's provided by a bigger temporalis muscle here, and that is exactly what we are talking about. But we're going to keep going. There's a lot more that we can do with botulinum toxin. It really helps if you know what you're doing. Again, and this is more advanced, but it definitely results in wider smiles for patients. As you can see, there's before and after. Look how her masseter has really come down to a normal size. Look how big they are all the way to the left, and they've really given her a much better shape, and that allows her to go to a wider smile just by relaxing those masseters and giving a better shape. Gummy smile, again, I wish I had time to talk about all these different things, but gummy smile treatment takes exactly about 30 seconds, and those of you who give it probably are saying it doesn't even take that long, and we know that, but I got to give it some time there. 30 seconds, a couple of spots, but if you do it wrong, by the way, and it's really precision Botox, and that's what we teach in our level 2 and level 3 course, this is real precision. We're talking about micro units for this. If you give too much Botox to relax a gummy smile, their upper lip is around their knees, and they can't show any teeth and barely move their upper lip, and they will not be happy. So it's real precision that we're talking about. Here's a great case by our good friend, an AAFE member, Dr. Cook. She was a journalist, and she came in with these massive masseters, and he took care of her. You think that she helped make them famous in their area? Just amazing. Now, all the way to the left was when he first saw her. In the middle is about 4 weeks later. It takes time for these huge masseters to go ahead and reshape, and the second one is about 6 to 7 weeks later with a little bit more botulinum toxin at that 4-week appointment there as well. So there's a lot you can go ahead and do. Your training questions. There are a lot of training questions. For now, I would please ask you to go to aafetraining.com. I can spend a little more time at the end on training questions, but and congratulations to the few of you who have already grabbed some packages, so we cannot wait to work with all of you here for that. So use that code AAFE500 for gold package or higher for an extra $500 off before tuition goes up January 19th, and there's the upcoming. Again, you can lock this in and use these courses the rest of this year, next year, whenever you would like to go ahead and use them there. But all training questions, again, I'll get to them a little bit later. But what I do want to get to is going to be the new Botox lip flip, but I've got to give you a little introduction because we're going to use these for the new Botox lip flip as to what solid fillers, smooth PDO threads. You're going to see how this is going to really help that Botox lip flip as we were going to go. But let's tell you a little bit about solid fillers, smooth PDO threads. Basically, PDO means polydioxanone, and this is the way it comes, smooth threads. It comes in a hypodermic needle, obviously all sterile, and there's this thread that is threaded through that, held by a little styrofoam piece on there as you deliver it. You'll see how we deliver it for this, and just that other pictures just to give you an idea. 29 gauge smooth, about 30 to 30 or 40 millimeters is what we are going to use. And what does it do? What do these magical PDO threads do? They are polydioxanone. That's what PDO threads are. PDO stands for polydioxanone. It's an absorbable suture. It's been around for 50 years in medicine and dentistry, but when you use it for aesthetics, when you put it in what is called the subdermal plane, then as it slowly absorbs, the body's natural reaction to it is to create its own collagen and elastin. And that's amazing what you can do. And that's what you see in this photo here. This is all collagen that has been built on by these smooth PDO threads that have been placed in the tissue. So this is all brand new collagen. Takes time for the body to regenerate it over time. But it rejuvenates the skin, it revascularizes it. It's called neocollagenesis, does an amazing thing for skin. We're going to use it for lip borders to really turn those lip borders out, as you can see. Just one warning, again, I'm just giving you what we're using it for specifically here. There are tons of uses for it, as I'll show you here. But one thing about it, there are about 25 companies in the U.S. that sell PDO threads, and there are only 3, maybe 4 that we would consider using, because many of them are not FDA cleared class 2. Many of them will not tell you where they're made. We require FDA cleared class 2, known origin and proper packaging, FDA packaging. And for us, these are the only 3. That top line is what we will consider. And the only one we use is VSoft Lift, as you'll see why. It produces the most collagen, and it's the strongest when it comes to lifting threads. The ones underneath there, the companies will either not tell us or you or other people the origin of them. They come from China, South Korea, and they've got to come from a real manufacturer. If the company's not forthcoming, they're not going to be on our preferred list or improper packaging. So we will not use anything below the top 3. FDA listed class 1. And I am sorry if some of you have some of these. I wouldn't touch them with a 10-foot pole. Anybody can pay to get listed on the FDA site. You need to be FDA cleared class 2, 510K. If you know the particulars, most of you really don't care. But you do care about your license, right? And why in the world would you use a blank package like this, okay, with a little sticker that could be anything? This is the way it should really go ahead and be packaged there, as you see on the right there. And we deal with, in the AAFE, we deal with medical, dental, nursing boards. I was on the phone with a couple today about cases, patient complaints. It's your license and it's your fine. The companies will be long gone. And some of these companies will actually lie to you. It's unbelievable. And they'll literally tell you, you don't need it. It's not true. We applied to be class 2. You can't sell until you're class 2. I mean, that's pretty much clear class 2 and known origin and proper packaging. A lot of monkey business. Stay away from that, because ultimately, if there's a patient complaint, it's your fine, it's your license, and you can see it can be some pretty stiff suspensions here if you use fake Botox fillers, PDO threads that are not properly cleared. But the reason we use VSoft by far, and this is why so many of you have been frustrated over time, if you've been trained by some of the other companies, is they've got to use so many more threads, and that makes the actual procedure almost intolerable for patients. And that is really it's supposed to be a non-surgical, minimally invasive technique. And if you use the right thread, and that's why VSoft the strongest and also produces the most collagen by far. For every 1 VSoft, you need 3 to 4 Nova threads, 4 to 5 Mint PDO. And it's not me telling you that. It's them telling you that, because when you compare the cases, and if you want, I'll show you a lifting PDO case later on. These are not VSoft Lift. These are some of the others that I mentioned. If you need this many threads, you are using the wrong PDO threads. That means their PDO thread is not producing a lot of collagen, which is why you need some money. These are invasive procedures. Some of the other trainers that teach some of these other threads and techniques, they'll tell you, we will sedate the patient. We will put every patient afterwards on antibiotic steroids and narcotics. That's crazy. Okay, we don't put Botox patients on narcotics. You've got to use the right thread, and that's what it's all about. So that's the introduction to the new Botox lip flip, as you are going to see right now. We're going to use smooth PDO threads for the lip borders to pop them out and define them, which you could never do with filler by itself. Never. And now, again, I'll answer questions a little later on. But let's go ahead and show you. I want to show you some of this technique for that. It's not the whole video because it's not the whole training, but certainly gives you a good idea of what you can do. No filler. You can use filler or no filler. This patient actually did have filler. I'm going to show you a few with no filler, and you can decide on your own. Here we go. And what we are doing here is we are just going to accentuate the vermilion border, and that's what Megan is doing. She's going to put a solid filler PDO thread, a smooth PDO thread from a new bio, and that is going to go along here and really pop out this this border here. She's going to do that on the upper lip and the lower lip, and then we are actually going to go ahead and add some micro Botox there to get some more vermilion show. So the combination of the two treatments would come out really well for her and really do really well for her. So that's doing great. How you doing there, Lindsay?
Good.
Good. So far, so good. So she has had some Comfortox BLT-like material on her lips and sitting there. How long was it on there? Probably 15, 20 minutes or so, something along those lines here. And that is looking good. Hang on there, Lindsay. You're doing really well. That is good. Just follow along that vermilion border. You're doing just great. These are 31 by 30, so this will give a little bit of more of a subtle roll and also a subtle vermilion border there. That's good. That is looking good. And if you need to come around to the other side, you can come around to the other side there too. Okay. How's it going, Lindsay? Good? Okay, super. She's a super patient here. So that is looking really good. Vermilion border pop out, and that's what this is all about. This is about popping out the vermilion border. She had dermal fillers, I think you said in January or not too long ago, right? So her lips are pretty well filled to exactly where she wants them, and but she really needs some definition in this in the vermilion border here, and that's what we are concentrating on. So between this and in the vermilion border, and then we're going to give her some micro Botox to go ahead and do a lip flip. That is going to give us more vermilion show, and then the combination of the filler in there and what we're doing now is really going to be very significant for her. So we're going to do a couple more. Those are their 31 by 30. Now what she is going to use is going to be I'm going to kind of show this, a little mini thread. And this little mini thread is going to go ahead and finish off that Cupid's bow by going right in there. So let me just show you exactly where we want this to go. Yep, right in there. Just start at the top of the Cupid's bow. This is going to go right into that vermilion border. Perfect. Slide that right in. Make sure it's past the thread. That's good. Okay, and you can leave that. And then we're going to do one more. You want to come around on this side? How you doing, Lindsay? You're doing fantastic. And it's got you really important. What's super important here is the treatment that we're doing and the sequence of treatment here. We are doing threads first, and we are going to do micro Botox right afterwards. And the reason that we're doing threads first and then micro Botox is we don't want to do micro Botox first and then threads, because that could then deliver the Botox to areas that we really don't want to deliver to. So that is great. Twist and remove, and she is doing just great. Fantastic. She's been using the Comfortox Vibe. She went between Comfortox BLT, Comfortox Vibe, and the technique. That looks great. Now just take a look at what we've done. Look at this beautiful vermilion border. Now it's got much more definition, much more of a white roll. That is looking great. So let's go. Are you ready to go straight to the micro Botox? Let's go straight to the micro Botox. How are you doing, Lindsay?
Good.
Yeah, you're doing really fantastic. So micro Botox, this is a highly diluted botulinum toxin concentration, and this is going to be a very superficial delivery of this, and it's going to take a few little pokes here to go ahead and do that. I guess
Sorry,
pokes.
little pinchy.
Yep. Sorry, pokes is not exactly a scientific term, but a few little injections. We're going very superficial. The whole point here is to get us very superficial fibers of the orbicularis oris to quiet down, and those deeper muscle fibers of the orbicularis oris will go ahead and push out and literally flip out that vermilion border to give her much more vermilion show, and it's going to look fantastic. I mean, already, and the nice thing is about her, you can come around here if it's better. Yeah, go ahead. The nice thing about her is she already looks fantastic, so we're going to make her look even more fantastic by just getting that little more vermilion show, which is really going to be really outstanding. I mean, it's really great. And it's so great to do with or without fillers in the lips, depending on the patient. You really need training. You need AAFE training for all of this. That goes without saying, to get the best lip results and the best facial aesthetic results all the way around here. So that's looking just great. Lindsay, you are a fantastic patient, and we just gave Lindsay some Botox in her masseter temporalis, forehead, glabellars, crow's feet, and all those areas there as well here, and a little brow lift too. So she's had a lot of treatment today in a short period of time. How you doing, Lindsay?
Good.
Okay, great. She did just great, and we'll get her back, and we'll see what she looks like when we're all done. And you can create incredible lips just in general. Let me just go back to one thing here. Here we go. Give me a second. The computer just has a mind of its own, as many of you know. And you can create really just amazing things with this. But that Botox, the little extra Botox lip flip, and we are using micro units total in that lip. Maybe we used a unit and a half, 2 units. If you use a lot more than that, guess what? That patient cannot use their lips, and that can be very frustrating for all of them. But look at the pop out of those vermilion borders. You can only do that with smooth PDO threads. And here is a no filler lip, okay? So she's got a nice enhancement right here with just no fillers. The only thing that she has had some microbotulinum toxin in around the lip. And also it's given in a lot different way than you would treat radial lip lines, which is just deeper part of the muscle. It's just a different muscle for all of that. So what we can do with it, and we have full trainings just on the micro Botox lip flip, because it is a really specialized technique. If you give a little too much, then their lips can barely move. If you give too little, nothing will happen. But we combine it with smooth PDO threads, with fillers all the time for just incredible lips. By the way, when you're doing this, it would be, if you're doing combination, it is fillers first, it is then smooth PDO threads, then it is the micro Botox lip flip for that, if you're doing all of them together for good reason. You don't want that Botox to get too deep in the muscle or get to any other muscle there as well for that. But you can deliver this too. And by the way, just to give you an idea of how profitable solid filler smooth PDO threads are, if we just did lip borders, or we add lip borders on to any lip enhancement, it's anywhere from $350 to $500. It took exactly 3 minutes, as you saw, but we would never get the borders that this patient would want without it, and they are fantastic. And we don't just use smooth PDO threads for lip borders. We use them a lot to build cheeks and collagen. All this is built up over 3 treatments of smooth PDO threads, 10 PDO threads, smooth PDO threads with V-Soft Lift. You would need 40 with any other one on the market here. Why would you go with 40 if you only need 10? And you can build up their cheeks. They build collagen over time. How long does collagen last, by the way? A lot longer than filler. Filler will last 6 months, 12 months. You are talking about that this can last 2 years, and it can be really fantastic. Usually 3 treatments, 4 to 6 weeks apart, to get this kind of a result, and results can last 12 to 24 months, and the typical fee is about $750 per session for all of that. And those of you who would love to add smooth PDO threads, lifting we'll talk about in a little bit, but smooth PDO threads, the AAFE has got the only live virtual CME certification training. This is an 8-hour CME certification training course that includes the full AAFE on-demand certification training, 1 box of smooth PDO threads that's worth by itself $350, and a live virtual Zoom session where one of our faculty members will guide you through how to put this on. You can practice on a piece of chicken, you can practice on a skin pad, you can practice on a few things, and they can tell you exactly what to do. It is fantastic. If you already do Botox and fillers in your practice, you should at least start with smooth PDO threads, and you don't have to leave your home or office. The next live virtual session, which you can do all the on-demand now, and you'll get a box of smooth PDO threads. By the way, for the live virtual Zoom session, you'll only use 1 or 2 packs of the PDO threads. Once you learn the right plane to put them in, you'll go straight to patients like this provider did. An hour after the session, he was treating patients with it. It's really amazing if you have some experience with Botox and fillers already. That's exactly what you can go ahead and do. It's AAFEvirtual.com, $9.97, save $500 off, because it's usually $14.97 for 24 hours. AAFE members, you can save a little bit more for that. So literally your first case will pay for the training, and this one includes a box of threads. This is a huge deal. Add it to your practice if you already do Botox and fillers. But let's move on. We're going to show you sharp jawline and smoothing that neck. So jawline tightening and neck slimming all in one treatment here. So we're going to show you that as well. Now, and that's, it's amazing. Look at all these muscles. And by the way, in all of your training, if you're a medical professional, which is going to be most of you, you've learned these muscles at some point in time, but it really didn't mean much to you. But now it can really mean something to you as you go ahead and develop an outstanding Botox practice. And like I said, in the AAFE curriculum, level 1, level 2, level 3, over time, I mean, my goodness, we cover nearly all of these muscles, and you can do amazing things. But let's go ahead and show you how do you get a sharp jawline and how do you tighten up the neck with this. But I got to tell you that this is going to be in combination with lifting PDO threads. At this point, in the video I'm going to show you now with just the botulinum toxin application, at this point, I'm just going to show you that, but she's already had the lifting PDO threads. If you want to stay afterwards, I'm happy to go ahead and share her lifting PDO threads there as well. But let's show you her treatment. Let's go. Let's show you some full face botulinum toxin treatment, the right way to do it and how to get the best results. So here we are starting with the frontalis muscle. You can see patient is cleaned off very well and everything is marked, and we'll take you through it here. So the frontalis muscle that we are treating right now, first of all, we're using ComfortTox syringes. You want to go ahead and be the most comfortable injector, and that's going to be ComfortTox syringes, 31 gauge multi-bevel needle, sharpest one on the market, and that's why this patient is barely feeling anything here. What do we want to accomplish with the frontalis muscle? We want a good, even distribution of botulinum toxin all the way across the muscle here. But we are going to stay mid or to upper a little bit higher on the frontalis here, because we also want to lift their lateral eyebrows, and you'll see those injections in just a little bit. How do I select the muscles is so important in the glabellar area. That's the procerus muscle. Look how we're holding this muscle and isolating it, especially here. This is on these corrugator muscles. If you are sloppy or hold it the wrong way, it will drip down to the eyelid opening muscles, and all of a sudden the patient will get eyelid ptosis here. So we've prevented eyebrow ptosis by being mid to high up on the frontalis muscle. Here we are going to prevent it from getting to the eyelid muscles, because that is the worst complication you can get from botulinum toxin, which can last for a few weeks up to 3 months. So prevention is everything, and great technique is everything. So between the eyes is done, frontalis is done. This goes pretty quick. Now it is crow's feet, or the lateral orbicularis oculi muscles here. She has had some lifting threads and some smooth threads, and that's why you see some of those band-aids in place. Botulinum toxin always goes last. when you go ahead and are doing multiple procedures in one appointment here, because we don't want this botulinum toxin to move. We're being very precise in where we're placing this botulinum toxin. That by itself is the key. And we're also holding and isolating each muscle. And here we're really stretching the skin so that these ComfortDoc syringes will literally just glide underneath the skin. And you must always be going away from the eye. You're always going away from the eye, and also making sure that you are in the right plane. There we were showing you how you could get the zygomaticus major and minor muscles if you're not careful on those crow's feet injections here. So you've got to be very careful. Now we're going to the superior lateral orbicularis oculi muscle, which squeezes and pulls down that lateral brow. We're going to release it a little bit, and by allowing some of the frontalis muscle, the lateral frontalis, to maintain its activity, that combination is going to go ahead and give her a subtle lift on the lateral eyebrow. She's already got beautiful eyebrows and a nice apex of the eyebrow right there. We want to improve it a little bit with botulinum toxin. That's exactly what we are doing there here. So now let's go ahead and go to some of the lower face. Here we're doing the mentalis muscle, and this is going to get rid of any dimpling of the chin and also help more shape the chin area right there. 2 quick injections, but make sure you stay in that midline. If you're off the midline, you can get the depressor labia inferior muscle, and that would be bad because it would look like the patient had a stroke. Here we're doing the DAO muscle, depressor anguli oris, and again, you see how we are not going straight in. We're angling it back to laterally because we also want to stay away from the depressor labia inferior muscle. Anatomy is everything, and in the AAFE, we are anatomy crazy here when it comes to it. If you know the muscles, you can literally reshape somebody's face with botulinum toxin, and that's exactly what we're doing here. Now we're going to the platysma muscle. Now, we've already gone ahead and done some lifting PDO threads on this patient, and we've tightened up her jawline with that. Now we are going to treat this platysma muscle with some botulinum toxin. What will that do? That will relax that pull on the mobile part of the platysma. Relax that pull because that pull blunts the jawline. So we have literally lifted and snatched it back with lifting PDO threads, but now we are going to relieve the platysma muscle, and that's going to drape better over the jawline and give her an even tighter jawline. So it's about using multiple injectables to get the desired results here. This will also get rid of those vertical bands of muscle, which many patients don't like. Now remember, this is in the mobile part of the platysma. There's a mobile part and there's a static part of the platysma that is defined right by that mandibular ligaments. You've got to know what you're treating, and again, making the point, anatomy is absolutely everything here. Now, the other thing that many people don't realize is that this platysma also will go up, and it starts to interdigitate and become some of the other muscles, specifically with the depressor anguli oris muscle. This can go up and be a part of that. So this platysma can actually, by treating it, we will affect the corner of the mouth and give a straighter appearance to the corner of the mouth. That's what we were doing with the DAO muscle injection that we did. But this will also help the corner of the mouth, the lateral bands, not so much the medial bands as we're seeing here. But this will also tighten up that chin. She has had smooth PDO threads right in the same appointment to go ahead and tighten up that chin, get rid of some of the chin fat permanently. And now this botulinum toxin will relieve the platysma muscle. And again, that's going to help tighten it and drape the platysma as it comes over the jawline and create a better jawline for the patient. So again, multiple things, lifting PDO threads, smooth PDO threads, botulinum toxin can really tighten up that lower face using different kinds of mechanisms of action. So you've got to be trained in all of them. You've got to understand all of them, but ultimately it's about the anatomy, knowing the muscles, but not just knowing where they are, how they work, which ones are depressors and elevators, and then bouncing them off each other by going ahead and either eliminating their action or reducing the intensity of contraction. And you can literally reshape faces and necks and do amazing things with botulinum toxin fillers and PDO threads. and get the results that you want for total facial aesthetics, because there is no way to do this without botulinum toxin dermal fillers, solid filler PDO threads, and lifting PDO threads, all of which this patient had. Now let's look at her before and afters, and that is amazing. Take a look at that nice relaxed face. Take a look at that neck, and now you're going to go ahead and see this is where the magic happens. The Nefertiti lift, along with lifting PDO threads to bring everything up, smooth PDO threads for great collagen biostimulation, as you can see right there, but also some dermal fillers for really making that snatch jawline and building that corner of the jaw. All those things you can learn to do too. You must have them all for total facial aesthetics, so you need to get AAFE certification trained today. And let's take a look at just side to side. Her before and afters are really amazing. And again, that's a combination. If you lift up with lifting PDO threads and you relax the muscle, that's how everything really tightens up. And that is really just an absolutely amazing result here. I did not show you her lifting PDO threads. That's why she had those big Band-Aids on there. She obviously loves chewing gum because she was chewing gum through some of that procedure. She didn't do that, I guarantee you, during the lifting PDO threads for all of that. So that, I mean, that looks just great on her. But of those of you who want to stay, you know, a little bit longer, I'll show you her lifting PDO threads. But right now I'm going to end up taking questions in the next few minutes, but I just do want to show you some before and afters and really success stories. The AAFE's got thousands of members, like our good friend Dr. John Hendrickson. That's his wife, who kind of told her story on social media. She's a dental hygienist. He's a dentist, but he built out an entire med spa in addition to a very busy dental practice. She's the wife hygienist, but now she's the laser technician, and really with her daughter runs that med spa, and they are having just a ball. They're in a little rural area of a town in Indiana of 700 people, and people flock to this practice from all over. I mean, it's amazing. They have patients from Chicago. They have patients from really a huge radius. And how many practices do these people pass on the way to their practice? It's really, really incredible, because that's the power of what we can do these days for that. And we've got tons of RNs, NPs, physicians. Like I told you, it doesn't matter the letters after your name. If you're a licensed medical professional, you can be the best injector. But again, and also it's just not just about Botox. It's about Botox, the fillers, lifting, smoothing PDO threads for really total facial aesthetics. This patient, I mean, people have told me that can't be the same person. That is the same person. She also runs the cosmetics counter, all the cosmetics counters at the local Nordstrom's, which is about 2 miles from our office. What do you think? You think she sends us plenty of patients? All she does every day is deal with women that are looking for cosmetics. And I mean, she sends us probably more patients than anybody over the years, because, I mean, she's a living example. But you can't do this just with Botox or with fillers or the combination of those two. You really need everything all together for all that. So let me finish this segment. Those of you, if you want, tell me if you want to see the PDO threads, the lifting PDO threads on that last patient. I'm happy to share it with you if you want, because that's a big part of it too. And at least you should be aware of what it can do, and some of you are ready for it. But how does it affect your practice? Adding Botox and fillers. So in the AAFE, because we have thousands of members, we have the capability to go ahead and we can go ahead and survey our members about a year after they've gotten trained and said, how did it affect your practice in terms of the bottom line? We get a lot of other statistics for that, because we really teach comprehensive care in all of our courses, but certainly the higher the level you go through, the more comprehensive care that you are delivering to patients. So about 1 year in, after practices have gone ahead and integrated Botox and fillers into their practice, we'll just go to the bottom line here. So AAFE members who have introduced Botox and fillers in their offices have seen an average increase of $32,500 of production per month. Many of these are dentists with existing practices, physicians physicians with existing practices, so they can do a lot, they can do a little. Some of these are doing much more in terms of that. I mean, we've got practices in the AAFE that are doing $100,000 a month just of injectables. Why? Because it takes very little time. So literally, it's up to you and how much you want to go ahead and do this. And certainly the AAFE, like I said before, is the only organization that can help you and gives you post-course support for all those things. So let me go ahead and take some questions. I'll take some quick questions here. Let me just do a couple more things. Those of you who want, this is going to be 2 weeks from tonight, learn perfect tear trough treatment with Botox fillers, PDO threads. 2 weeks for tonight. It's only $79 regularly, $249 through January 26th, but there are only 200 spots available. So it'll sell out probably way before this. For that, and you can save some money. So if you want it, sign up. Comes with a 14-day replay. That's one of our patients. We'll actually show her course, her case, and show you a number of different ways, because tear troughs are either a home run or a total disaster. And you don't want to be the total disaster. They're very tricky, but they're the #1 requested treatment right now for this. AAFE Cadaver Lab, the best one on the market. You can save $1,000. There are 6-7 locations this year. So you can get it. PDO thread, lifting PDO thread treatment coming up. Follow us on Instagram, Facebook, YouTube, and TikTok. And here, I'll take a break to answer just a couple of questions in a minute, but all training questions, and please only take live patient CME certification training. That is so important. If you ever get called to a licensing board, if a patient ever complains, and you know the kind of society we live in, that's just the cost of doing it these days. Anybody can make trouble for anybody. That's just part of it. Thankfully, you don't have a problem 99.9% of the time, especially if you're well trained and know what you're doing. For that. So, you need CME certification training. It's the first question they ask you if you have to go in front of the board because of a patient complaint is where you've been trained. Oh, I went to Sally that I saw on Instagram. People actually say that. And these medical dental nursing boards say, they just laugh. Are people serious? These are real medical dental aesthetics, are real procedures in medicine, dentistry, and nursing. You're held up to the same standard as anything else. It's not a Botox party. It is real medical dental nursing treatment for that. And I'll put this up again. First of all, those of you who have grabbed packages, we can't wait to work with you. Pam, Peter, Julie, Sam, Audrey, Jose, Kimberly, Meryl, Morgan. I think there's 1 or 2 packages that are left. So if you want it, grab it. Go to aafetraining.com. Basically, it's as many many courses you get in each package. If it's gold package or above, use that code AAFE500 for gold or higher. You'll save an extra $500. Tuition goes up in a couple of days, just like everything else is going up, and there are only a couple packages available. But we cannot wait to work with all of you for that. Those are our upcoming courses. The entire 2023 is scheduled already. And again, lock in these packages. You can take this next year. I don't know why you would want to. You want to do it as soon as possible. And as you can see, we go to have over 50 different locations around the United States for all that. So let me leave this up because there are a lot of training questions. So I'll leave this up for that. We come to Kansas, Tamara. That's for sure. Let's take a look. No, Michelle, good question. And you usually most people, especially dentists, take our level 1 Botox and fillers and oral facial pain, trigger point therapy, all in one group of courses, all over a Friday, Saturday for that. There's a whole on-demand for each course. So each course is 10 hours of CME, live patient training. You come to the live patient training day, and usually level 1 is partnered with Frontline TMJ Oral Facial Pain. So definitely go ahead and do that. If you've taken a level 2, if I've had level 1 training, would level 2 be the next one? Yes, absolutely. Go in order for sure. for that. What kind of chair do we use to treat these patients? They look pretty comfortable. We buy a comfortable chair. I mean, some of them are dental chairs, but those are really pricey. But you can get these MedSpot chairs that are fairly reasonable. I think $1,500, $2,000. A dental chair easily can run you $8,000, $9,000, $10,000 for that. But they can be pretty comfortable for that. I've been injecting for 6 years. Been using PO threads for that. I'm going to share the lifting PO thread that we use and the technique. It will blow your mind, but you can't do the technique I'm going to show you with the threads that you're using, because you need so many more threads of the threads that you are using for all of that. For the lip flip injections, no, we don't want we want a tight dilution. We want really precision botulinum toxin. We do not want a very diluted dilution, 4-to-1. Some of you who are more advanced will know what we're talking about. We want 1-to-1 or tighter. So that's more advanced that we teach in AAFE training. For that, let's take a look. Welcome. I'm a dermatologist from Toronto. We've got a few derms and plastics and everybody else on there as well. Does treating the laterally on the forehead cause any eyebrow drooping? No, treating laterally on the forehead does not cause eyebrow droop. Treating too low on the forehead will cause eyebrow droop, and or treating someone with shallow eyes will cause eyebrow droop, even if it's not treating low on the frontalis. If you don't know what the difference is between shallow, medium, and deep set eyes and Botox dosage for the frontalis, you have not been AAFE trained. It is the single most important indicator is what their eyes look like for frontalis dosing, but we'll have to come to training and we can certainly tell you all about it. It's a little bit more than that for that. When you make the temporals work harder, depends on the patient. Does it cause headaches? No, it doesn't cause headaches on the right patient. They don't have any kind of oral facial pain, and that's why we use that on. Let's take a look. Can nurse practitioners do dental blocks for lip filler? Sure, all the time. I mean, at some point, pain is the most common fear I hear about, even with BLT. So a lot of great question, Lauren. And first of all, yes, you can use dental blocks. We rarely use dental blocks. We teach them in our level 1 course, but again, once you get some experience, most of the fillers, if not all of them at this time, have lidocaine in the filler, and we use the strongest BLT, which is Comfortox BLT. They feel a little poke, and then they're pretty much numb for all of that. So again, when we teach level 1, people are really taking their time. So some dentists like to give dental blocks, but we rarely use them in practice. We don't do it a lot, but it's a good skill to have for sure for all of that. So let's take a look. Yes, congratulations for signing up, Farun. For a package. So it's great. Iris, congratulations to you. So I think 1 or 2 more. I can't remember how many names I went ahead and said. All right. Well, let me show you this slide, one more slide, but then we're going to go to lifting PDO threads for those of you who want to stay extra. Let me just see if I can get this to move. Here we go. Again, there is my information. There's my email if you want to shoot me an email. And there's all the different websites. You can take a photo of this slide. If you are a dentist, I would direct you to toxtestdrive.com, which is a special new program where you can offer dentists only for now. We will probably over time expand it out. The AAFE will expand it out, but right now it's only offered to dentists through its partner StatEDS. You want a program that will kick up your injectable practice where you can offer your patients 10 free units of botulinum toxin, neurotoxin. In this case, it'll be Xeomin, and through a partnership with the AAFE and StatEDS. It doesn't cost you anything for the 10 free units that you're going to give patients. You have to buy an initial amount of Xeomin and also sign up for this program, which is $99 a month. I mean, it's meaningless. You literally can get up to almost up to $2,000 of free neurotoxin to give to your patients. So dentists only, go to toxtestdrive.com if you want more information and you can learn more about it. We've had a couple of people that have signed up. We only open this up to about 20 people at a time. I think there's 1 or 2 left for this session because the AAFE only takes 20 people at a time, so they can really work with them to really, and some of them, people that have been on this program for now a month or 2, they are producing I mean, $9, $10, $15,000 a month profit from just neurotoxin procedures. It's incredible. So hopefully we'll expand it out. But if you're a dentist, you can check out toxtestdrive.com. Check out all of these websites to take a screenshot. AAFEvirtual.com for those of you who've asked. That's where you'll go for the live virtual CME certification training for smooth PDO threads there as well. All right, you want to see, those of you who are going to stick around, let's show you a lifting PDO case for this. V-Soft Lift by far, that's what we're going to use. This patient had first came in for lifting PDO threads. Never had Botox, never had fillers. That is pure PDO threads. One to the after is a few months later. It was holding up really, really nicely for that. Let's show you a little bit. I'm just going to give you the really crash course on PDO threads. And again, we're going to talk V-Soft Lift. Why? By far the strongest thread. And I'll show you. And again, it's not me talking, it's every other thread company that shows you this that's talking. So lifting PDO threads typically come in a barb thread, which is the top here, or molded threads. Again, no time to go into that now, but the V-Soft Lift is about 4 to 5 times stronger or 10 times stronger than any other barb thread on the market there. You need 4 to 5 times as many of the other ones as you do of V-Soft Lift. And the molded threads are even stronger than that. And that's for heavier tissue, more challenging cases. We talked about smooth PDO threads. Just to give you an idea of what they look like, they actually attach to the SMAS layer, which is going to be underneath the fat, epidermis, dermis, subcutaneous fat, and then you are going to be underneath the fat, the SMAS layer right above the muscle. That is the same layer that plastic surgeons do something called a mini facelift, where they go in and they grab the SMAS layer, pull everything up and back. You're pretty much doing the same thing for all of that. So that is with, but you're doing it non-surgically, minimally invasive here. And I mean, a typical V-Soft Lift, you need 4 or 5 threads. A typical others, you need 20 threads per side of the face. Again, these are very invasive procedures. I can't remember if this is a Nova Threads or a Mint, but they're going to look exactly the same. You've got some of their trainers have bounced between the two companies, and they're using so many threads. Why in the world would you need so many threads? Because it's a weak thread. That's why you need it. And this is a nice result on the right side of your screen, but is it worth 20 threads? I'll let you decide. I mean, some of the things you see on Instagram or social media are crazy, are just absolutely insane. And again, they will sedate these patients. They'll put them on antibiotics, steroids, and narcotics to do them. They'll tell you that. I mean, they'll tell you that's what you need to do. We don't do any of that because you don't need that many. So the question for you and your patients, and I guarantee you a lot of you are babies, you don't want 20 on each side of your face. You want 4 to 5, because if you use the strongest thread and use the best techniques, then that's the kind of results you're going to get. I'm going to show you that same patient we just showed you. She got her botulinum toxin treatment after the PDO threads, which relaxes the tissue, helps square up, tighten the jawline, and smooth the neck. But what we did beforehand was give her a physical lift. Then you take out the muscle action, and that is going to, two together are going to give her an absolutely gorgeous, gorgeous result, as you're going to see. So now I'm going to go ahead and show you her lifting PDO thread treatment. Here we go. There is a fantastic case, and let's show you how we use lifting PDO threads using AAFE protocols and techniques here. So first of all, the skin is cleaned up very, very well, and we've marked the patient, and we are going to go ahead and give a little bit of local anesthetic right at the entry points where we're going to put those pilot holes using a ComfortTox syringe, lidocaine 1 or 2%, no epinephrine preferably, and we're going to go ahead and mark the vectors that you go ahead and see. Now, few things. I want you to take a look. Look how diffuse the jawline looks right now, and a little bit of gelling that is happening on this patient. And certainly you can see her as she's talking and the way the face moves. Now we're going to lift and tighten everything using V-Soft Lift lifting PDO thread. So watch a few things. First of all, watch everything tighten up between right now and by the time that we are done, and then go ahead and take a look. See see how few lifting PDO threads, V-Soft lift threads that we need, compare it to any other brand that's on the market or any other techniques, and you will see these by far have the fewest PDO threads, the best techniques for the absolute maximum result. Putting on some Botox BLT underneath her chin, where we're going to also put some smooth PDO threads as a part of this appointment there too, to get rid of some of that chin fat permanently and really tighten and smooth the skin underneath the chin and in the neck here. Yes, you can get rid of chin fat permanently with smooth PDO threads here. So we're going to do a few things here, but now let's go ahead and show you the AAFE technique for lifting PDO threads here. So first, you're going to use an 18 gauge pilot hole needle. This is crucial. Make sure you go in at the right plane right here and the right angle. This is everything, because this is going to start you off by putting you into the right plane. It's being in the right plane of tissue that is going to be so crucial here to make sure you are going to get a great result. Now, the first thing we do, though, is we pre-tunnel with a Botox cannula here and give a little bit of lidocaine along this track here. Now, that's a Botox micro cannula, best ones on the market. Look how smoothly it glides through the tissue, and as we go ahead and go through the tissue, we are giving a little bit of lidocaine, just a little bit. We don't want to flood the tissue with fluid, because then we are going to have a little trouble with the actual PDO thread being able to grab the tissue here. Now, what is the right plane that we are pre-tunneling with? What we are doing here is we are going to make sure that we are going to be above the SMAS so we can engage the SMAS, and that is going to lift up the tissue. But here we're just giving a little bit of lidocaine all the way down that track, making sure we are in the right plane here. As you can see, don't have to come out of that pilot hole. We are going to now go ahead that second vector and go down, and you'll be able to go ahead and see. Just gently go ahead and put this through. Now, most microcannulas will really frustrate you because they will dive into the tissue because they are too flexible. Not the Botox microcannula. It is the best. Look how nicely it guides through. Patient is very comfortable, and we are giving some lidocaine. They will feel this a little bit, but once as we give them lidocaine going in and also coming out, and this is very little, maybe 0.1 ml in each one of those pre-tunnels there. So now that we've done this, it's going to make the rest of the procedure so much easier, because now we already have a tunnel for that lifting PDO thread to go ahead and be able to go through. And for this, we are going to use some of the molded V-Soft lift threads called the Arty threads, and this is the Arty 1 thread, and it is a strong thread, much stronger than anything else on the market from a molded thread. Look at the technique. We are going step by step, never forcing anything, using our non-dominant hand to pull the tissue over this, curtain over the curtain rod. And as we pull out, we are really going to exaggerate that lift, and look at that beautiful lift. One thread. Now, you compare this to any other FDA cleared class 2 thread on the market, you would need 3 to 4 to 5 threads to get that same result. Same pilot hole. Now we're going down that second vector, as you can go ahead and see. And we are going to go ahead and use that same technique. We're going to place it in, and it's really the non-dominant hand pulling the tissue over the lifting PDO thread that's been pre-tunneled. It's in the right plane automatically. We're going to keep watching it as it goes all the way through, always knowing where the tip of your instrument is. And now we are going to go ahead, exaggerate that tissue, pull out, and look at that gorgeous lift. Now, those are vertical and diagonal lifts, so you can really see how well it has done. Now we're going to pull that real tight, and we're going to snip that right down at the plane of tissue. And that is it. You don't need to tie these off. You know, you see any other threads that needs you to tie them off, that means it's a very weak thread, and that causes a real knot at that end, and patients really dislike it, and it just causes problems later on here. So now you can see that is a great result with 2 V-Soft Lift molded RD1 threads. That is really amazing here. Now let's go through this vector here, and we are going to do the same thing. Look at the angle we're going in, this is going to already create the start to make sure we're in the right plane of tissue, 18 gauge pilot hole, and that is the area that we numbed before. Let that in there just a little bit. Now we're going to go ahead back in with a 22 or 25 gauge Comfortox microcannula again. This is with lidocaine to pre-tunnel this, get the patient nice and comfortable, make sure, look how easily that glides. This has got the right flexibility. You can see the other end of that microcannula here. Now we're going to deliver a little bit of lidocaine, as you can see as we come out. You can also do this anterograde or retrograde to place the lidocaine, but never too much, because we don't want to flood this area with too much fluid here. We want to make sure that the lifting PDO can really engage here. And now we're just going to go ahead and do the exact same thing. Look how nice this lift has really come up. And if we needed, we could always add another thread, but look what 2 threads have done. Now watch the magic with 1 lifting PDO thread, V-Soft Lift RD1 molded thread, and go ahead and in the horizontal plane and pull this back and watch what happens. And you will see just an amazing result here. Get this into that pilot hole and make sure you go ahead, are in the right plane. Use your non-dominant hand, pull the tissue over that as it advances. We are never ever forcing anything, always knowing where the tip of that is, get it down to where we want it. This doesn't take very long. Pull that back and then pull that thread, the cannula out. Look at that sharp jawline with just the one. Pull it really tight. Now go ahead with your scissors and push down on the tissue. You see that little dimple there. As you smooth that out, that is completely going to smooth out, and that is looking fantastic, and it's only going to get better over the next day or two. But look how much tighter that looks. Look how lifted that looks. That is just an amazing result that all of you can go ahead and do, and that's all we need. 3 threads. I would challenge any other FDA cleared class 2, and there's a lot of junk threads that are out there. I would not use it unless it's FDA cleared class 2 with known origin and proper packaging. Put a little band-aid on there, and that just stays on for a few hours to make sure it stays nice and clean. Look at that jawline. Look at that lift. Now you can go ahead over this and you'll feel some of the engagement of that PDO thread. You want to make sure most of it, if not all of it, is engaged before the patient leaves. Look how strong these threads are. That's 3 V-Soft Lift PDO threads, and that is AAFE techniques, and you can get a gorgeous lift. And now looking at this case, you tell me there's no way to do total facial aesthetics without using Botox fillers, PDO threads, lifting, and smooth PDO threads for collagen building. There's no way to accomplish it without being able to lift sagging skin. And that's exactly what you see right here in this case here with a minimum amount of threads. All right, so you get the idea there. And again, here's her before and after, as you can go ahead and see, and that is really amazing. And again, this is the combination of lifting PDO threads and botulinum toxin, and this is again a week or 2 later after the botulinum toxin has kicked in, because that relaxes the tissue. Now it can really be lifted up. It will last a much longer time, and that is really, really incredible in terms of what we can do for patients that we could never ever do before. And that's the kind of thing, and it just takes training. And again, this is not your first injectable. You're going to start off with Botox and fillers, but sure gives you cannot do total facial aesthetics without Botox, fillers, and lifting and smooth PDO threads, and that's it. Everything else is extra, but without a physical lift, and fillers do not lift. They never have. They never will. Okay, you can put, if you usually bloat the patient up so much, so it kind of looks lifted, but they look so bloated that it's not a good look for people there as well. Those of you who are wondering, what do we charge for lifting PDO threads? Again, we're charging for a result, not for the number of threads. If you go for the number of threads, by the way, when you do those cases with the other threads that I showed you before, of 20 threads on each side of the face, I mean, how much can you charge the patient at that point? I mean, you just can't you just can't charge the patient enough to cover your cost of the threads, because each one of these threads is $50 or more, depending on who you get it from. You're into the cost of the threads because you need 20 instead of 3 or 4. I mean, it's not a profitable procedure unless you're charging patients $10,000 each. We don't need to charge them $10,000 each. We will charge them anywhere between, depending on what we're using. But this case right here, 6V soft lift, 19 gauge by 90. They come 19 gauge by 100. They've got different lengths and gauges. You can see your cost of the threads. It's got a very high, it's probably the most profitable in terms of our ROI and profitability, lifting PDO threads, once you learn and get good with it. Treatment time is 20 minutes. No antibiotics, no steroids, no narcotics afterwards like you need with the other threads. Number of treatments is 1. Results can last 12 to 24 months, sometimes longer. Sometimes you got to throw in an extra thread. That's all okay. That is all. I mean, that's the way to do it. Really, that's the way to do it. I'll answer some questions on threads here as well in just a minute here. And here you have, she is a nurse practitioner. She is an AAFE member. And of course, she's got her own med spa, and she treats patients there as well. She's not going anywhere else. Look at the difference. And again, she has had botulinum toxin, she has had fillers, she has had lifting PDO threads, usually lifting PDO threads first, and then lifting PDO threads first, then you go back with botulinum toxin, which can be done same appointment, and then fillers later on to put it in. Smooth PDO threads, which will build collagen, which will eliminate underneath the chin fat and fat wherever you put it in through different mechanisms of action. You can learn that when you take that course for all of that. It's just incredible what we can do for patients right now. So let's go ahead and let me answer questions. And again, I'll just put this training up because this will answer a lot of questions, or you can go. You can go to AAFEtraining.com. Code for the discount on the Tear Trough class, just go to AAFEwebinars.com. And right now it's set at $79, but it will be going up. But it's only 200 people, and I can tell you a whole bunch signed up tonight. You're the first group to know about it for all of that. Are the V-Soft threads just stronger or a little flexible? When I was trained by Nova Threads, it was taught not to cross the upper and lower jawline for that. Sometimes we cross the jawline, sometimes we don't for that. Again, I don't know what they taught you, but again, when you have to use that many threads, they're going to teach you something different for that, and we don't use that many threads. They are stronger. Are they more flexible or not more flexible? It's just a better PDO thread, in our opinion, because that's why we need so few, and that's why we get such good results with 3 or 4 or 5 threads as opposed to 20 threads on each side for that. Many times, again, more advanced, we do neck lifts and tighten the neck and do those kind of things there as well. There are lots of great fillers. I mean, there's so many great fillers that are out there. Sata carries the MERS line of Radiesse and Belotero, more specialty fillers. They'll be coming out with more. But Versa, the Juvederm family, so many great fillers that are out there for that. You need to learn the fillers so you can best educate your patients about the different fillers, because all the different fillers are great. They are all just different. They're like different tools in the toolbox, and they've got different flexibilities and textures and how good they are. No, PDO threads are not palpable when put in correctly. For all that, it takes a little bit of getting used to for that, for sure. In our level 2, we talk about smooth PDO threads just for lip borders, and if you go through level 3, we do more smooth PDO threads, but we have special smooth PDO thread courses for those of you who are already doing this for that. Let's take a look. Let's see. I noticed the injector engaged the threads after the cut was complete. No, she did it both times. She engaged it as she was pulling out. That's kind of that sweeping motion. But then you go back a few times, make sure all of them are engaged. We do it before and after. You want to engage those barbs or those molded threads for that. So that is That's what she was doing. We keep going over it because many times the providers don't engage them enough, and then that can cause some problems there as well. You folks were really great, and thank you so much for staying extra. Like 98% of you stayed for the entire thing, so we really do appreciate it. For that, let's take a look. Yeah, you can, Vanessa, if you've been certified by another group, you can absolutely order Vsoft threads, and they can help you through the changes that you'll need. Your life will change dramatically if you are offering another PDO thread, Vanessa, and you change the Vsoft lift. You're going to do PDO threads the way they should be done for all of that. That is really great there. So that is. That's about it. Marcia, I'm not exactly sure your question, but you can email. And again, final call for AAFEtraining.com. The final call for this, but email info@facialaesthetics.org. Marcia, if you have a question about some kind of a program, if you want the webinar that's coming in a couple of weeks, go to afewebinar.com, and you will get that webinar for that. Thank you, Jana. You are awesome too. You are all awesome. I can't thank you enough for being on, but we're here to help you, and you feel free to email me or the AAFE. We have got a lot of people you see in that photo there. We have got the best faculty of dentists, physicians, nurses, nurse practitioners, and PAs that are out there that can train you. They are all such special people. They're great providers. They all have practices of their own. That's part of what makes the AAFE the premier, the #1 CME certification live patient training for Botox fillers and PDO threads. And it's what makes all of us successful, is learning from each other. So really, I can't thank all of you enough. So we'll do this again. I hope to see a lot of you in a couple of weeks for that. You don't need a discount coupon for the webinar 2 weeks from now. Right now, the price is set at $79, so just sign up and you'll do it. So we'll see a lot of you in a couple of weeks, and we give these trainings free and those that are paid every so often. Just keep a look at afewebinars.com or let us know how we can help you. Really appreciate it. Take care, everybody. Great to see all of you. Continued success. Stay warm, and we'll talk to you all real soon.